I am Christina. I'm the Deputy Manager in the Little Sisters of the Poor in Greenock. We are now using the DocBo system for around 6 weeks. So first of all, we did have training on how to use the system, how to register staff in the system, how to get our passwords, and then the team has helped us to register all the residents in the system.
I'm James, I'm a senior carer, Little Sisters of the Poor in Greenock, Inverclyde. So with DocBo we received a tablet which we could liaise with district nurses on. It's very simple to use and it's a really effective tool for us. The training was very simple, it's very straightforward and it's basically step by step what you need to do if you've got anything that you want to send to the district nurses about your residents. The screen's very big, the questions are very big as well, so you're not having to kind of look at little small writing. It's very easy to follow. Anybody within the care home could log on and know exactly what they're doing with this.
What I will say is really good about the resident of the day, it is that the data is collecting. From month to month we can see if there is a deterioration. I can see exactly that is transformed into their weight as well as it is in their skin changes. What is also great about the resident of the day is it does ask us about the mental health of a resident, and as we know in nursing homes we do have lots of residents that have dementia or different mental health concerns. So with the resident of the day we can then see if there is a change in that. Not only that is asking for a full presentation of the resident, but it does ask about the full observations, like your blood pressure, your saturations. If one of the parameters may be higher or lower than what is normal for that resident, we'll still alert the liaison nurse to say there is a change, which is great in the fact that somebody else will get in contact with us to see if there is a change, like what's happening, why is the saturation going down, and just have that bit more of support than what we had before. On the Restore to tool as well, when we do put the presentation of the resident, what is good is that you have all the information in the system, and then when there is a change you can see where the change has happened or the time frame that a change has happened, which is great for me as the deputy manager and overseeing the clinical need of the home, is that I can spot when has happened, and sometimes or most of the time it actually shows why it happened, because putting all the notes in the system, it is a trail of the information to see exactly where you started with a concern and where you are going with that concern and what has been done in between for that resident. We have done a video call consultation with the liaison nurse. She was able straight away to have a look. If she wasn't sure exactly what the presentation of the skin was, we were able to take pictures, send to the liaison nurse, and the liaison nurse to relay with the GP right then and there. And we did have an answer within maybe an hour or two, which was very effective. We didn't have to wait for hours and hours for somebody to come out.
One of our residents was displaying symptoms of a UTI. So when we basically pick that from our drop-down list, we then get questions. What are they displaying? What are the symptoms? That information then will go straight to the district nurses, who will get back to you within an agreed kind of time frame, which is usually 2 hours. We got a phone call and we basically explained some of the same answers again on DocBo, and from that the district nurses were able to prescribe an antibiotic, which we were able to get that day, which saved a lot of distress for our resident. If we didn't have that system in place, what would normally happen is we would phone the GP with the same information, who would request a sample first, which would be a day. They would then decide whether they're going to issue an antibiotic, which could be another day. So you're adding 2 days of distress to a resident, which could be fixed in 2 hours with DocBo basically.
What is great about the Dockable system is that we are able to see all the notes that the liaison nurse is doing. It's validating, to be honest. We have done an assessment together, and then there is a decision, and you can't just misinterpret it. We are all accountable for our own actions. It's very clear what has been done and what is to be done. If a resident takes unwell in the morning and doesn't need urgent care, night shift staff are able to do an assessment, put it through the Dockable system, and in the morning when the liaison nurse starts at 8:30, we usually get a phone call or a message to ask what's happening, how is the resident been overnight, do I need to come straight away, which is great. That being said, it means that in the morning I don't need to spend an hour on the phone with a GP. I can utilize that time to do the medication round, or the nurses to do their medication round. Or if we do come in the morning and a resident does present unwell and that resident needs care, it takes 5 minutes to request an assessment, opposed to calling the GP, waiting on the list, then speak to a receptionist, to then pass to the GP, to then come out to do an assessment. So the time trial, it shortens a lot. I'm able to monthly review how many GP calls were out, how many times we went to the liaison nurse, or if we did require any urgent care as well. So it does cut my time on paperwork because everything it is in one system. Then at the end of the month, I can just request a report from the system. It is extremely beneficial when we are requesting care out with the home. We can print a day report to send to hospital, to A&E, or we can print this for the GP when they do come to assess residents. It does give a full overview. It does help me with overseeing the clinical needs of our residents, and as well as it does help with quality assurance, which is extremely important for our yearly inspections.